it drives fuzzy butts all over this big old world of ours absolutely crazy when they hear me say it. I am the host of this show, your big dog, Luke Robinson. And if you can believe it, we have back this week Ginger Morgan. She's the executive director of the Puppy Up Foundation. Ginger, how are you feeling? We missed you last time.
Well, I'm feeling better. My voice is back to about 85-90%, so that's good. So I'm looking forward to it. I'm sorry that I missed the podcast last week with Dr. Modiano. Did I say it right?
Dr. Modiano.
Modiano.
Okay. The Italian. Modiano is how he said it. Yes, it's a beautiful name, but yes, it was a great episode, and definitely I recommend it. We even without you, I think we did an hour and 18 minutes, so lots of good info for our audience. Just a reminder, you can find us on your podcast platforms such as Spotify and iHeart Radio, or you can watch it live here, see Ginger live and in person and flesh on our YouTube channel. That's Fuzzybuttsstudios.com. Well, we have an interesting topic. It's exciting and it's sort of on the cutting edge of what I think, Ginger, is the future of veterinary medicine. We have Dr. Shadi Ireifej. I'm sorry. I knew I was going to butcher it. I knew it. I wrote it out. I'm sorry. Please tell the audience how to correctly pronounce your name for us.
Shadi Ireifej.
Shadi Ireifej. I'll try not to mess that up again. As I said, sometimes my mouth moves faster than my brain. He is the chief medical officer of a wonderful company called VetTriage. And Ginger, he's here to talk about telehealth and veterinary medicine and what I think is the future. So welcome to Fuzzybutts and Friends, Shadi. May I call you Shadi to
Absolutely.
Make it easy on me?
Yeah, Shadi's fine, and thank you for having me.
Thank you. All right, well, I knew our first question on our talking points threw you a little bit because you weren't really sure what a fuzzy butt is, but we always like to start our show off with what our show is about fuzzy butts. So tell our audience, do you have any pets, any companions in your life?
So this may be a unique response from a veterinarian, but I have no pets in my life currently. Part of the challenges with it is we all know how much care they need. I travel a lot for VetTriage, and so it just wouldn't be fair to them to share that responsibility on my own anyway. So no, currently I do not. So I get the benefit of enjoying everybody else's pets on a global scale through VetTriage.
Yeah, I understand that. I'm sure at some point you'll become sedentary in your life's travels, and you'll find yourself a fuzzy one. We all need one. I didn't really get one until later in my life as well. So yeah. I completely, because I'm the crazy busy, always going somewhere. Fortunately, now I have fuzzy butts that can travel with. Oh. All right. Well, tell us about this exciting company, VetTriage. Tell us actually, before we get into that, tell us your origin story. How did you get involved in veterinary medicine, and how did you get involved with VetTriage?
Sure, thank you. So I grew up in upstate New York and Middle Eastern family. Having pets was not really that big of a deal, and so I had learned the value of pets through volunteering at a hospital, Newburgh Veterinary Hospital in upstate New York, and realized, wow, this is a really big deal. You not only can heal animals, but you actually heal people through healing their animals. That idea was profound to me. And that got me into Cornell University for veterinary school, where I graduated in 2006. After that, during vet school, I decided to pursue a board certification in surgery. So I went from Cornell University to a one-year general internship at Angel Animal Medical Center, used to be called Angel Memorial Animal Hospital in Boston, Massachusetts. After that 1 year, I did 2 years as surgery intern at Long Island Veterinary Specialist in Long Island, New York. Proceeded to stay on at LIVS, Long Island Veterinary Specialist, as a surgical resident. So that's 3 more years of residency. And then had to pass my surgical boards. And finally, I was board certified in surgery. And so from there, I ended up going from Long Island, spending almost 9-10 years there, to out west, where I preferred warmer weather. I'm much more of a warm weather guy for sure. And I practiced at Las Vegas Veterinary Specialty Center in Las Vegas. Was there about 9 months. After that, I did some locum work, so I spread around the country doing surgeries at facilities that needed to give their surgeon a break because they only had like one surgeon who was on call all the time. And so I'd go and relieve that surgeon in different states. I'd go Utah, Kentucky, wherever I was called upon. After a few months of that, I managed 3 facilities in Silicon Valley. So between San Jose, Mountain View, and Campbell, I was managing those 3 hospitals as the only surgeon, being on call 24/7. Did that for about a year, and after that, got the opportunity to be one of the owners at True Care for Pets in Studio City, so in LA. And I was there for about a year and a half, and then ended up launching VetTriage towards the end of 2019. Essentially moving back to Las Vegas after True Care for Pets in LA, and then I've been doing VetTriage ever since. So the reason why VetTriage came about is because when I was a surgery intern, I was watching the receptionist handle 100 phone calls every 24 hours at a busy 24/7 emergency facility. And I thought, boy, they're answering the same question over and over again. Clients are asking, my dog or my cat or my parakeet did this or did that. Should I come in? Should I be worried? And I thought, what if you had a way of getting that call to a doctor instead, and had them answer that question for the pet owner and leave the receptionist alone? They're busy enough doing their own jobs, let alone having to tell clients, I don't know, I'm not medically trained. Do what you think is best. And that idea sort of grew over years, and then finally became a reality then of 2019.
I want to backtrack just a second to Angel Memorial. That's part of my history. My first dog, that's sort of my mission, my journey out in life, traveling cross country, educating people about cancer and our Fuzzybutts. My first Fuzzybutt, Malcolm, he was DX'd with bone cancer, and just one day he couldn't get up, and I took him to Angel to get checked out, and the cancer had spread to his lungs. So love Angel, wonderful organization, and that they have a rescue too, and it's history too. It's been there for so long. They've just done such a wonderful job. I wanted to give a shout out to Angel because it's part of my history and the history of my Fuzzybutts. So it's exciting so it's there. From all of the different practices in your travels, that's how you that was the genesis of the idea for triaging veterinary care. Is that a fair assessment?
Absolutely. And now when you look at the current veterinary staff shortages and the cultural toxicities and the work-life balance issues, all these factors, triaging these cases not just on behalf of the client, but also of the facility that wants to sort of just offload all this work to somebody else, it's been a huge relief in the veterinary field. And and so I saw that benefit many years ago. The point also being that this was not induced by the pandemic. This concept was already in the works way before a pandemic even existed. So it was just something that I always knew was going to be needed in the field. It was long overdue. It just took a while for the technology to come up because, back then video wasn't really a thing, right? It's 2006, 2007, 2008. Maybe you had Skype, but that was about it. And so I wanted to devise my own platform. And so we built our own video platform. And now, of course, video is mainstream, right? Everybody's got video. But back then it wasn't. And I thought, boy, I don't want to do this over the phone. I want video. You need video. You want to look at the pet. And so it just took a while to build that sort of platform that I wanted.
So you're the founder and the CMO as well.
Correct.
Excellent. I love people that see a problem and then spend the amount of time it takes that's necessary to come up with a solution. And I know the pain and the problem that you're speaking to is one that I'm sure every pet parent's familiar with, is that if anything goes wrong or slightly not usual or normal with my Fuzzybutts, I have a heart attack immediately. That's the first thing I do. I have a heart attack, and then I get focused on, okay, what's going on? And then, but I do the thing that I know that pet parents shouldn't do, is pick up the phone and call the vet clinic and start talking to the receptionist about, hey, I've got this going on, and here's the problem. And of course, the response, as you know, is, well, I'm not the veterinarian. But what's interesting, and we'll get into this more later, one of our points is that you said that really veterinary medicine, and to a certain extent, are really being a pet parent, there's just a lot of redundant data out there. Mm-hmm. And if pet parents had quick access to that data, and more importantly, a trusting person to assure them, that, hey, that I'm reasonably certain that this is a problem, this is what's going on, that's all they need until they have an opportunity to see their ordinary vet, right?
Absolutely. If you look at the amount of resources that are out there for anyone that has a device, have access to everything from social media platforms to Google searches, there's a ton of information out there. And it's not that the pet owners can't find information. There's plenty. You put in a couple keywords, There it is. The problem is, how do you distill it? How do you prioritize it? How do you know that the source of that information is accurate? And even if it were accurate, well, how do you know it applies to your exact pet with what symptoms you're seeing with the pet? And so you need a professional who's seen that particular case thousands of times to be able to tell you, here's the story. Statistically speaking, your pet probably has this condition or these top 3 conditions. There are other possibilities as well, but this is how we're going to prioritize them based on what you're telling me, what I'm seeing on video. That's massive for a pet owner. I mean, that's massive. That's priceless. And when you go online, I compare it to a bowl of soup. It's a bowl of soup. There's a bunch of information in there. They have no idea how to prioritize it. What a doctor does is they take that bowl of soup, they put it in cabinets, in drawers, in folders, and it's all organized in algorithmic ways to be able to find it, distill it down to say, here's what we think is most likely going on with your pet based on my experience and based on what you're telling me. That's the value of talking to a professional literally at your fingertips 24/7 on any device.
Yeah, I would say accuracy would be at the top of the list on concerns or why the value add that VetTriage has to offer, because you can really find so much data, but like you said, sorting it, understanding it, and then more importantly, relying on its veracity or accuracy is the real problem. Well, tell us, Shadi, how VetTriage works from start. Tell us about the process.
Sure. So on the platform, we have about 50 to 60 doctors at any given time, depending on their personal lives. Some leave, some come back. It fluctuates. That's one of the benefits of having a work-life balance. You can choose your own schedule. We've got English-speaking and Spanish-speaking doctors 24/7 for any animal type. We've currently reached about 35,000 cases since our launch, the end of 2019. We're partnered with several hundred hospitals, including Cornell University, University of Minnesota, Humane Societies, SPCAs, and we've been accessed by 15 different countries who want pet care. Most of our clients come from the US and Canada, but 15 different countries have utilized our platform, and we've triaged 35 different animal types. Fish, ostrich, lizards, birds, dogs, cats, you name it, we've probably seen it. And so that's the foundation of the platform. What'll happen on the client side, the pet owner side, is they either will find us through a referral, through their family veterinarian or a Google search, maybe a friend or family member used us, go to our website, they'll create an account, pay the $50 to talk to the veterinarian, and they're on in less than a minute. It's a very quick process. It is a web-based platform. It's not app-based. And that was on purpose. I didn't want an app because in the event of an emergency, I don't want a pet owner having to struggle looking for an app at the app store, downloading it, and then going through the whole process. Just go to the website, follow the instructions, and you're on. It's very quick. You don't know how scared of an emergency they're dealing with behind the screen. Once they're on with the doctor, average wait time is less than 2 minutes. They're on video right then and there. Doctor can take medical notes while also examining the pet and quizzing the client, the pet owner, on what's going on with their pet. From there, judgment is made as far as is this an emergency or not, and then those medical notes are shared with the client. They can share it with their clinic, or if the clinic's already partnered with us, we can share it directly from our platform to the clinic. So they'll have records when they open again the next day or the next week or after that 4th of July holiday, whatever it is, they'll get records. That way there's clear communication on all fronts. But we go beyond that. Let's say that pet's condition changes and it's still a long holiday weekend. They don't have access to veterinary care until at least Monday, Tuesday. The client can actually reach out to us at no additional charge by email or phone to say, hey, something else is happening with my dog. I talked to your doc yesterday. Can I get another opinion? We'll re-triage them right then and there, no additional charge. And they basically have us until they can see their regular veterinarian. We'll keep reevaluating that pet if the condition is changing that often. We can always change the plan and say, look, yesterday your pet was stable, amenable to home care and monitoring. Now, Saturday morning, not so much. Now we're a bit more concerned. Let's change gears. And we can help them. That way the client doesn't feel like they're alone in the process. So that's the entire platform. That's how it operates. It's a very simple concept. The internal workings of it, all of it is proprietary technology that makes it very smooth, very efficient for our doctors and for the pet owners.
Yeah, speed and efficiency, I like that. I mean, that's one of the most aggravating things. I've called it poison control a couple of times, and being put on hold is just painful. Even having to wait in an ER it's just frightening.
And when you go to the emergency center, like I went by a specialty center to drop something off not long ago, and literally it had, like, for the emergency thing, basically if it was an extreme emergency, the wait was still like 1 to 3 hours. if it was like your basic emergency, it was like a 7 or 8 hour wait in their room. You know, I mean, I'm like, and I know I've taken, of course, because no emergency happens between 7 a.m. and 6 p.m. None. Zero, zilch, nada. It's always like 6:05 once the clinic's closed. And I know I was there for hours with the dog that had a pretty severe an emergency, bleeding and everything. We were just in the group with everybody else. I'm like, oh, it was, I wasn't the most patient person.
I'll do you one better. During the height of the pandemic, we were seeing 72-hour wait times at the emergency room. 3 days, because 3 days was still faster than their family vet can see them, which could take weeks to months. So people were waiting, almost like you'd wait for a table at a restaurant, wait for the buzzer to go off, but you're doing that with your emergency pet in your car, just waiting, or going home and they'll call you when they're ready for you. It was a disaster, and we couldn't act fast enough and catch up with all of it. We just kept drilling away to get in front of the practice owners to say, this is VetTriage, this is what we're aiming to do, we can help you. Let's partner and let's get this done so you guys can focus on true emergencies. We'll take care of the ones that are not true emergencies, band-aid them, and then they can see their family veterinarian at their convenience. And it's a win for all in that situation. So yeah, those wait times can go way beyond 6, 7, 8 hours.
I can't imagine if I had like a true emergency and I had to wait that long. I would probably just get arrested. But anyway.
Offloading limited resources is a tremendous value add for vet clinics. But to speak to what Ginger went, and also your point, the point you were making is, you know, I've been in a situation where I've been in an emergency clinic and I wasn't entirely certain whether I should be there. And it would take that amount of time, and they would have to use up so much of their resources to make that determination that could have been determined elsewhere. So that's a tremendous benefit to pet parents. We find ER is never a good experience at all.
We find in our platform that well over 80% of the sessions we see are not true emergencies. And that same number, it really is echoed even in brick and mortar. Over 80% of folks who are waiting there because they're not sure if it's an emergency or not could have just went home with basic monitoring and care instructions given by a veterinarian. But they have to wait there the several hours for a professional to tell them on the ground whether they still need to be there or not. We find over 80% don't. So we can funnel those 20% that are emergencies to the appropriate facility and let us handle the 80% plus that aren't. It does wonders for the vet community because, like you said, they're allocating resources and that's creating stress. And it also does wonders for the pet owner who doesn't only just not want to be there for the stress and time of the animal, but also financially speaking. If they don't have to spend that money, they prefer to put that money towards future care of their pet, vaccines and heartworm prevention, diets. So it just works for everybody involved when used appropriately.
I had a friend one time who called me and he said, I'm sitting outside the emergency vet place waiting for it to open. It doesn't open for another 15 minutes. And so I'm trying to talk him off the ledge, and I'm like, what happened? And he says, well, her foot is bleeding. And I'm like, well, what did she do? You know, what is it, a gash? Is it whatever? Because she broke her nail. I'm like, get in your car, start it, come to me, we'll dress it, clean it up. And then, you know, if it doesn't stop bleeding, you can go back or, you know, see your regular veterinarian tomorrow. He was a medical resident, human medicine, and it was the funniest thing I've ever seen. Somebody just totally freak out. I mean, it's just, I mean, I freak out about my own pets, but yeah. It was funny because I had him helping me wrap it, and he was just putting the vet wrap on there, and I'm like, gauze, you know, some kind of bandaging on the inside. Just it was pretty funny. But anyway, it wasn't really a true emergency. So.
It's funny. I know you're talking about Matt's, and he and I are similar. When it comes to human gore in human situations, I'm unfazed. But when it involves my boys, my kids, I freak out. 80% is really a phenomenal. It's a staggering number, especially when you consider the price of your service is only $50. And last time I checked, just to get an ER doc to look at your kid is probably $350 down here in the South, probably more expensive up north.
It's at least $50 or $75 when you hit the buzzer for them to, let you in. That's the beginning of it.
Yeah.
The question, here's a really important question I have, is being the father of 3 dogs I've lost to cancer. All of them in their own various ways had medical crises throughout their treatment, throughout the diagnosis, throughout the illness. And so if I'm on a weekend or something like that, I can't get my GP or can't get a board certified veterinary oncologist, and I have a special case, do you have specialists such as veterinary oncologists or people there that would be able to speak specifically to the condition, albeit maybe say hemangiosarcoma or something like that? So are there tough cases that you just say, you know what, we can't say either way?
No, what's great about the having everything on a virtual scale is that those 50 to 60 doctors that are on this platform, we're all in a group chat. And so if somebody wants to get a second opinion internally by another doctor or doctors, they just throw up the questions there and doctors will start jumping in. I have veterinarians that are located all across the world, which is all different time zones. So you've got doctors in different countries with different experiences being able to collaborate with cases that's currently happening right now in real time. It's a beautiful collaborative effort. And keep in mind, the doctors that are helping that fellow colleague, they're doing that out of the kindness of their own heart. They just want to help. That's not part of their job description. They're just doing it. And so, yeah, if there is a case that may be beyond the scope of the attending clinician that you're speaking to on the platform, they'll ask within seconds. They're getting responses from people, different ethnicities, different cultures, different geographic locations, different specialties, different veterinary experiences. So it is beautiful what you can do on a virtual scale in real time.
So if Luke, if let's say, he's calling in about one of his dogs that had cancer and it was having an issue, would it be beneficial to be able, if he had those vet records, to email them to the you all for the vet who's on call or however that works to look at?
That's a common question that we get from clinics that are looking to partner with us. It's, well, how do you access the veterinary records? What do you do? So when we first launched this, I was the only doctor on for a while because I wanted to set the groundwork for protocols that made sense for veterinarians. And I also wanted to, we also had to be able to afford our first doctor. And so in the early stages, I realized quickly, we don't actually need those medical records for our purposes. The reason why is because pet owners like Luke and like you, Ginger, you're so committed to your pets, you know their history by heart. I don't need to verify what you're saying is true. You have no reason to mislead me. You know the history. And most of the conditions we're dealing with are, as you said, acute emergencies at the moment. I don't need to know what the last 10 years of your pet's life was like. You know the summary of that information, right, but I need to know what's happening right now. And so it doesn't seem like medical records from our purposes are necessary. Now, do people share them? Absolutely. A lot of facilities now have like a cloud system where you can get access to your pet's records anyway. And so our veterinarians who have a VetTriage email are more than welcome to receive blood work, x-rays. We've even received CAT scans and MRI scans from pet owners that have access to them, and we'll be happy to comment on all of those tests. So it's not a problem either way. Doesn't seem to be necessary, but if you have them readily available, we will definitely look at them.
Okay.
Yeah.
Shadi, talk to us about telehealth in general in veterinary medicine. Is it taking off? Is it being adopted? And how big is it?
So telehealth is the broad description of anything virtual, using telecommunication technologies to be able to provide patient care. And the patient and the provider are located at different geographic locations. That's telehealth. Underneath the category of telehealth, there's all these different branches. We on VetTriage are focusing on the teletriage and teleadvice branch. There's also telemedicine, telediagnostics, teleconsulting, telescripts. There's a bunch of teles underneath the broad category of telehealth. Most people, both lay people and medical professionals, when they say telemedicine, they usually are referring to telehealth, but telemedicine is the hot button, like that's the popular word, and so they just use that to be synonymous with telehealth, but it's inaccurate. Telemedicine is only one category of telehealth. And so that creates confusion there. And that confusion, unfortunately, is deeply embedded in our current medical laws, not just in the US, but in other countries as well. So it's creating confusion. And when veterinarians get confused, and any medical professional gets confused, then they shy away. They're like, well, I don't understand. There's all these terms, and the medical laws are not helping me clear it up, so I'm just going to stay away from it. Just going to keep doing what I've been doing for years, even though we're drowning out here on the field, right? So telehealth is broken up into those different categories, and each category has their own very specific definition, very specific requirements in order to be able to do this, not just legally, but also ethically. Now, as far as your question about is it taking off, from the consumer standpoint, yeah. I mean, pet owners are used to video conferencing with Zoom or FaceTime or whatever. They caught on immediately. It's the professionals on the ground, the veterinarians and the veterinarians in the medical boards that are having a very hard time adopting it because they are worried about the legality and the ethics behind it. And so one of the reasons why I love programs like yours is because you're open to saying, talk about it. Tell us what the deal is currently, and it'll help educate those that are listening. Love it. And so it's taken off very easily on the client side, on the pet owner side. It's getting there on the medical board side. We are now at the point, because our credibility is held in such a high regard in the profession, we've had medical boards actually now reaching out to us looking for advice. Like, hey, here, you know what our current laws are. They're antiquated. What are you guys doing? What are you doing? And then they're going to decide, okay, what can we adopt from VetTriage and other companies that work in a similar fashion so we can update our current laws. And that's what we were hoping to do when we were spearheading this movement 3.5 years ago. And so it's finally happening where we've gotten the attention of medical boards to help. I've also helped write laws, by the way, in Kenya, as well as in Newfoundland and Labrador in Canada, because they needed help, and I said, I'll volunteer my info. And so I wrote up what I think law should be, and they can take it or leave it as they see fit. So we're intimately involved in this process to help spread the word, not just on the floor, but also on the legal front.
Yes, veterinarians, just like doctors, although I think doctors, MDs, are worse, veterinarians are awfully slow to adopt new technologies, new processes, and new business models. And it's even more so in specializations like veterinary oncology. They want a raft of studies showing, demonstrating, giving them the data before they do that. And I understand the reasoning for it, but as a pet parent first, it is frustrating. Why can't this happen faster, right? Why can't we do this faster, more efficiently? So I definitely feel your pain about getting veterinarians to sign on board with VetTriage. Well, we'll do our job to get this out there, because we do have veterinarians, a whole other veterinarians and specialists out there on Fuzzybutts and Friends. And then we also are able to get data through our foundation, the Puppy Up Foundation. We have walks all around the country. That's another way to get info to veterinarians as well. Ginger can tell you all about that. We some time ago, early on in this program's history, we had a good friend of ours, Dr. Rachel Venable, on, and she is doing, she cannot use the word telemedicine. She calls what she does teleconsulting. I think that's correct, Ginger. But she's a board-certified veterinary oncologist, and the pain that she's solving, much like hers, is that there's only a limited population of 500 and something board-certified veterinary oncologists in this country. Some states don't even have them, and it's extremely burdensome or tough for pet parents to have to travel 6 hours, 8 hours to get what they need. And we're a big advocate on this show of if you have a dog with cancer, go see a board-certified veterinary oncologist, period. That's the only way that you can get the access to the data that you need to make the right medical decision that you have to make for your Fuzzybutts. So that's a board specialty. But like you said, it's really an important distinction, is that's different. She's really doing almost like a practice. Well, she's not trying to take the place of your go-to veterinary oncologist, but she augments it, though, in that she can be more available, therefore allowing people that have to travel 6 or 8 hours to see in person their veterinary oncologist. They don't have to do that anymore. They can consult with hers. So it's and I think last time we chatted, her business is doing well as well as yours. So that's great news for pet parents.
Several points I'd love to address. That's excellent. I'm a board certified surgeon myself, so I specialize in orthopedic, soft tissue, and neurologic surgery. And unfortunately, a lot of surgeries that I will perform are patients that have suspected cancer. It's very, very common. And so I'm very aware of the specialty world and also how backed up they are in terms to be able to not only fit their patients that are in their own community, but folks who are trying to travel from farther away to get access to them. On the human side, the literature actually on this is very clear. If you live in rural Oklahoma and you need a specialist to deal with specifically with pediatric critical care, I mean, good luck finding anything in your state, let alone in the surrounding states, where that unique of a specialty. So that access to care, which is now a very popular buzz phrase, it applies to the human side too. And we, on the veterinary side, tend to be about a decade behind the human side as far as adopting new technologies, new procedures.
Right.
So all the medical papers that focus on telehealth, a lot of them will focus on people who can't get access to specialty care. I love that you brought up that point. And so we are trying to increase access to care as well through the virtual space for people in that same predicament. Yeah. That's massive.
And we didn't even talk about the wait time, which is a tremendous. It's actually irritatingly growing concern and issue even for myself. And we know the top veterinary oncologists in the country for our supporters and our family community. We're constantly contacted by people that can't get in to see an oncologist for something like 3 months. It used to be about a month. Now it's 3 months. And that's just, as you know, cancer at the point of diagnosis of cancer in a dog, it's pretty well advanced in most cases, and 3 months can make a tremendous difference. So that's just that one specialty. So immediate access to the first point, the triage, the first point of the medical professional. The triage is so important. I'm glad we're having this conversation and that you and Ginger connected, because I got to tell you, we'll get into marketing here in a little bit, how help market your company. But I never heard of VetTriage, and it's such an important service that you provide. I'm going to flip switches here and I won't say cast shade on your business model, but I have a particular interest and fascination about the intersection of artificial intelligence and technology, especially as it pertains to veterinary oncology. We're looking at doing a study involving that. And I just have a general understanding and passion and fascination with it. And I read recently, Shadi, that there was a pet parent, I think it was in New York, whose dog was pretty much diagnosed. I think it was their GP. I might be screwing the story up somewhat. My apologies if I am. But his GP said, I don't know what's going on. It's not good. So we're probably going to have to euthanize your dog. And he went back to his house and got on GPT-4. I'm sure you're familiar with that if you heard ChatGPT or ChatGPT or GPT-4. It's becoming an extremely powerful tool for getting the data and the information that you need. So
what actually is that GPT-4?
That's OpenAI's basically AI tool. There's Magi with Google. Elon Musk is starting his own, and there's one more. Facebook is doing their own as well. The big tech companies are all moving towards AI because they see the future landscape and certainly the market potential of it. So GPT-4 right now is the one that OpenAI built, and it's scary how good it is. It's gotten some of the top AI scientists and thinkers in this country to really want to take a pause because we might get into trouble using it way too fast. And people could also do harm. For example, you could type in the wrong query to GPT-4 about your dog's condition and get the wrong data and make the wrong information. So me personally, I would always want a knowledgeable professional, actual person, to take a look at my Fuzzybutts. So are you, Shadi, are you looking at AI? Because it's not only there's one way to look at it as a competitive threat. Another way to look at it is as a potential tool for you to use to help you out. So are you looking at AI right now?
Yeah, actually, on the human side, they've been utilizing artificial intelligence for a while. When you look at things like looking at biopsies for women at risk of breast cancer, for example, if you taught the artificial intelligence system, the algorithm, to look at 1,000, 10,000, 1,000,000 different biopsies, then that data set is massive, and so the machine can tell you very quickly with a high accuracy whether or not this is cancer or not. And that's what you're looking for, is a way to figure out objectively what diagnosis this patient has based on that data. The difficulty in that is training the system. You need to have a mountain of a database in order to do that, right? And then from there, the algorithm takes over and refines it. On the veterinary side, in clinical practice, they've been using that for radiographic interpretations. You take an X-ray for your pet, you submit it to one of these artificial intelligence X-ray companies, and they'll use their machine learning and go through thousands of scans to tell you whether or not that abdominal radiograph, right, that belly X-ray of your dog has X, Y, and Z abnormalities. And then they'll use the human radiologist to sort of verify ones that are a bit more questionable, or get a second opinion on, or whatever it is. So it's hard to get the human out of that, but again, that relies on a mountain of data. So on our end of things, what we are doing currently is, because there is a huge paucity of medical literature on the telehealth side in the veterinary field, we need more data. And so we are literally right now actually in the works of writing our first two of hopefully many publications to get the data out there. And then once we start getting into the thousands, tens of thousands and more, artificial intelligence on the telehealth side, especially the teletriage aspect, will be incredibly valuable.
Ginger, how many times on the show do you hear me say we need more data? I say that every episode.
Almost every time you open your mouth.
More data, more data. But
Yeah.
You're right. As AI, as we know, is built on large language models, and it's all data. And you said the right word. There was a paucity of data for all of veterinary medicine. I hope that we're friendly with Phil Bergman, who's running clinical trials for VCA. We had him on to talk about how they now own 25% of vet clinics, I think, in the country, and so they're going to have access to a lot of data. And so that's one of the topics of conversation we had with him was, are they going to make that data accessible? Because wonderful companies like yours could pay them whatever to access their data, so that because that 25% of the vet clinics, if they're able to aggregate that data so that it's accessible and learnable, then that's a wellspring. Everyone benefits. Pet parents all across the country benefit. So it's exciting times.
Where I see a danger in it is that if you have something that's automated that way, of course you can lower the cost. And so the pet owner says, well, sure, why wouldn't I plug in a couple of facts about my dog, pay $5 or whatever, and get an immediate answer, right? And so the problem is abusing that, not realizing its pitfalls as well. We don't have a lot of data, but there are companies out there that are utilizing AI on the veterinary front on a virtual scale that I think are doing it probably prematurely, and clients, pet owners are not going to be skeptical enough of that. It's out there, so why wouldn't I use it? And then they make conclusions and take action based on that. So that's where I see the bad part of AI is, at least from my very narrowed scope of the veterinary field, is having it be inappropriately utilized by pet owners who have good intentions. They have good intentions, but they're going to be relying too heavily on a service that hasn't been vetted appropriately yet.
Yeah, or they just input not the correct data.
Right.
Like, so garbage in, garbage out. They're going to get the wrong diagnosis. It worked out well for this case up in upstate New York, though. Mm-hmm. Apparently, he inputted the blood work or some data for his dog, and the dog had an extremely rare condition that ultimately proved out on it. But for me personally, sorry to interrupt, Ginger. Let me just get this point out real quick, and then you can jump in. For me personally, I think also for most people is I have to have the human there. I have to have the veterinarian there. Yeah. Number one is I want them looking at. I see AI as an adjunct to your job. Mm-hmm. Is that I want to know that you're using AI to make sure you have as much data on your end to make the medical diagnosis so that we can make the proper decisions for the best treatment and outcome for our companion animal. So I want you there, and that's never going to change. From here, I don't care how smart AI. Well, I personally believe that AI is going to kill us all, which is fine, humans. So long as they don't hurt our fuzzy butts, I'm going to have to come up with an agreement with AI on that issue. But I will always want the veterinarian there, because not only for that, but also the most important, I think, one of the most important things I think of your job as a veterinarian is the comfort to the patient, to let them know, because it's a very personal human thing to have your companion, your mate that's in a crisis. I always joke that I have a heart attack, but I really, man, for 30 seconds or a minute, even if something is simple, my three-legged dog Grayson just couldn't walk with his hind legs, and my thoughts immediately go to bone cancer, because I've had a bone cancer kid. So, you know, your bedside manner and the fact that you provide comfort and pet parent care, you help care for them as well. I think you said that in the intro, is that you like that part about being your job, is that you have the human element where you can be there for the pet parent, but you're also there to treat the companion animal.
Absolutely. You heal the person through their animal. That's what you do, you know? And yeah, our goal mirrors exactly what you said. We never aim to replace brick and mortar. We are simply an adjunct. We're a tool or an extension, however you want to see it. But we don't plan on replacing the brick and mortar, on the ground, hardcore, working veterinarian. That's not the goal here. We are a service, a provider, a tool to be used by clinics, rescues, academia, and pet owners as they see fit.
I like what you said. You're a tool and a pet parent's toolbox. Hopefully they have a big toolbox to take care of their kids, and you're an essential tool in there and not an expensive one. Ginger, did I talk too long that you don't remember your point earlier? My apologies for that.
Oh, I think I was just nodding or something. I don't think I really actually had anything to say, oddly enough. But now that you've said it, you know, I don't think pet parents can have too many tools in their toolbox.
Mm-hmm. Absolutely.
You know, to take care of their pets, whether it's a first aid kit, you know, a different kind of food that the dogs might use, your website, so they can call. I'm going to be calling all the time now.
You're welcome to.
But
I
think it's just, you know, there are so many things that when you get a dog or a cat or horse or some type of reptile, you just think, okay, you feed it, you love it, you take care of it, but then that just blows up, you know, the first time there's any type of little emergency. So yeah, you should see my first aid kit.
And so to that point, we're not just trying to increase access to care, so just simply getting access to a veterinarian, but also spectrum of care. So you had mentioned multiple times now oncologist specialty care, right? Well, not everybody can even afford that entry exam to talk to an oncologist, let alone consider options like limb amputation, chemotherapy, radiation, CAT scans, all the blood work you have to do, all the follow-up. So we can actually increase spectrum of care as well. So the crippling costs that you may find in brick and mortar, especially with specialty, perhaps that pet parent just wants to talk about the condition so they can know, well, do I have to take out my savings for this? Like, how is it worth it? And then to talk to an oncologist virtually, they can say, look, you know, if this is bone cancer and you're dealing with osteosarcoma, you're in $5,000 plus just for surgery alone. Maybe you follow with chemotherapy, another $5,000. Best case scenario, if you're lucky, 12 months. Most often 6 months. That helps that person who's already struggling with spectrum of care be able to say, oh boy, you know what, I need actually palliative measures here. I can't do that. That's gonna absolutely stifle my family, our savings. For that kind of outcome, let me find other means to provide palliative care, analgesia, even in most severe circumstances, hospice care for my beloved pet, because I can't go down $10,000 plus for a not so great outcome. So that increased spectrum of care is very important as well.
Yeah, I like that term, spectrum of care. Yeah, you know, the number we're using now, everyone's using now, is 6 million new cases of cancer in dogs a year. And you just think about the
11 a minute.
11 a minute. There you go. 11 a minute. Just think about the total. If you think the average cost of care and treatment, not palliative, but just the average cost is something like between $5,000 and $10,000, that's a tremendous financial burden worldwide, those numbers. So we definitely have to look at two things: the way to get costs down, number one, or make sure that costs are allocated or efficient. I like the term efficient costs. That's number one. And number two, then have the financial resources through foundations and also insurance, which insurance companies, insurers are doing a better job in terms of what they cover and how much they cover. Yeah. So it's spectrum. I love that. I love that term.
You can look at
go ahead, please.
You can look at the reverse way too for spectrum of care. If you know that if you were to find a way to collect $5,000, your dog had the 95% chance of being cured, that's a very different story. You might be like, you know what? Maybe it's worth breaking the bank on this. If my dog really has an excellent prognosis for the $5K, which is expensive, maybe it's worth it. So you can go either direction in terms of getting affirmation as far as what your next steps should be.
Yeah, I do want to make one little note, though, which is important for the audience, is that I think, to the best of my knowledge, that we're getting better outcomes with bone cancer right now. It's a good example, but I think with chemo amputation, you're looking at 50% make it over the 1 year threshold, maybe more than that. Palliative, which, as you know, is much shorter. But it's crazy how cancer is so different in every individual dog, and like I mentioned earlier, using the point of diagnosis, it's very advanced.
And I also wanted to comment too on that rate of cancer. You know, it seems to be increasing, let's say, right? Because you may ask why, and I'm sure a lot of folks are thinking, well, you know, maybe there's too much inbreeding, maybe it's what they're eating, maybe it's chemicals in the food or whatever it is. But let's not forget too, though, I've been in the profession for about 16, 17 years, and I have definitely seen that over that span of time, pet owners are more likely to pursue advanced diagnostics and pursue surgeries that maybe 10 years ago they wouldn't have done. And so I think that number, to some degree, not 100%, but to some degree, is also increasing because we are diagnosing more cancer because we're allowed to now. We weren't allowed to before because CAT scan was not as readily available. MRI wasn't as readily available. And the culture has changed to where they're putting way more funds into their pets than they were 10 years ago. So that number may be somewhat artificially increasing because we are being allowed to diagnose these pets, which is a good thing. The second point I want to make is, when you get older, you get cancer, right? Like, that's the association. Young animals, although it can happen, but they tend not to get cancer. So now that our pets are getting better care, they're living longer. When you live longer, you're more susceptible to diseases, and cancer is a common old pet disease. So those are two other factors to consider when you hear those kinds of numbers, is that we have better tools to diagnose, people are willing to diagnose, spend the money on it, and our pets are living longer, which means they are going to be more prone to those conditions as well.
Yeah,
I've had several dogs with cancer. I think I've had several dogs. I've had a lot of dogs. So I think I'm at 9 that have had cancer. And my veterinarian was like, you know, I would tell you to move, but all of your dogs, except a few, and even then, they were like 11, 12. I still count that as young because I have dogs that live to be 17. So, but yeah, I mean, and she said, but your dogs are old, so old dogs are going to wind up getting some type of disease, and it's 50% over the age of 10 are going to have cancer. And I haven't heard anything like, if they're 12, what is the percentage that gets over 12? You know, so I think I'm at just as they get older, the percentage gets higher than 50. I'm quite sure than the 50% over 10.
Hey, Ginger, I wonder with your 10th dog that gets cancer, I wonder if you're going to get a prize or something. What do you think? Hopefully you do. And
you maybe know what? I cannot voice what I think.
I was going to say,
I cannot verbalize that.
I was going to say maybe that prize is never have a dog that gets cancer again.
Now, that would be good.
Yeah.
Now, I've lost 9 to cancer, I believe. I'll have to go count it all up. But maybe Lily is the 10th one. And she had cancer at the first time she was 11 or 12. And then she got cancer in her GIST tumor at 13. And in November, she'll be 16 years old. So.
And knock on wood, she is still so much a puppy. She's doing great. And it's just a wonderful outcome. And just like you were saying, is that we're just seeing so much a much better outcome with cancer treatment. I'm sure that's true of almost nearly, if not all, treatments and all the specialties in veterinary medicine. It's just a marvel of innovation. And I'm so glad that because we often look at here on Fuzzybutts and Friends of innovation in terms of diagnostics and therapeutics. Yours is offering, as like you said, a spectrum of services, a spectrum of care, which is equally important because you have to have innovation across the board, business models, and the manner of servicing clients or consumers or customers, whatever you call them, is equally important. I just lost. Oh, there I am. I remember. So speaking about cancer cases and all these different ones, Shadi, can you talk to us about any notable cases that you've had since you've started VetTriage that are interesting or would be interesting, or maybe a good learning lesson for our audience?
Absolutely. So I'll give you one that actually relates to cancer, since we're on that topic. Hemangiosarcoma. It's a very aggressive vascular tumor of dogs, and it usually will affect their spleen, and it also has a very high metastatic rate, meaning it spreads quite readily, and it will spread to liver, lymph nodes, other organs in the body. The reason why it's significant is because if it does grow in the spleen and then eventually ruptures, now you have internal bleeding. And of course, hearing that, you don't need to be a doctor to know, well, that's going to be an emergency, right? Absolutely. The reason why I bring it up is because something like a ruptured splenic mass, internal bleeding, we call it hemoabdomen, can manifest itself in a variety of different symptoms. It may be just as broad as a dog who just suddenly isn't eating and is a bit lethargic. That's it. Well, what dog hasn't been in their life? What human hasn't been like that in their life, right? And so you would automatically think, well, obviously this dog is internally bleeding. Well, no, the symptoms are very generic, just not eating and a bit lethargic. And so you may not see that diagnosis, let's say, especially on a virtual scale, be evident, be obvious until it's much more advanced. Well, you don't want to wait for your dog to get advanced with something as time sensitive and critical as internal bleeding. And so I bring it up for the purposes of the VetTriage platform, and that's when our doctors have to sort of investigate, they have to use the tools at hand, which doesn't include blood work or x-rays. We don't have that, right? We have to figure out, well, based on this pet's age, breed, the history that this client is telling us, and now the video examination, what color are those gums? Are we looking a bit pale? Is that breathing kind of fast? Is that belly always that pudgy, right? You put it together and you think, boy, I don't know for sure, but I'm starting to be a bit more worried about something happening in the belly, more so than your dog is just having a bad day. And so that's we see that actually quite often. And now we can funnel that case to the emergency room and call them right in, because we have partners all across the globe. So.
And hemangio is one of those where when it happens fast and it's critical when it does. And and having a service like, or a set of eyes, that's just a wonderful. You have the belly distension, obviously the flushing of the gums, and we also have a very personal, very recent experience with hemangio. Ginger, you want to talk about Sadler?
Yeah. So he had some issues, obviously, but and we knew that he had cancer. We were fairly, maybe 98% sure. I was still that 2% because we had the oncocanine test done on him. I don't know if you've heard of that, but so it did come up that he had cancer, and we did a ton and tons of testing. So, of course, it's the last one, because you don't go past that. I found out that he had tumors on his heart. So, and when that was diagnosed, literally maybe 3 days later, he passed, and it was very quick. It had already spread to his lungs, and because we had chest x-rays like in August of last year, and then we did chest x-rays like maybe 8 to 10 weeks later, and then August there was nothing, and then the latter results where it was full. His lungs were full of cancer. So it spreads very, very quickly. And then I had another dog with just the tumor on her spleen that was also turned out to be hemangiosarcoma.
It's a tough one. And as you said, time is of the essence. So you need to go to the ER or not. All right, I think Shadi, I think we're kind of I think we've gone over the bulk of my bullet points as I review here my chicken scratch. I should have been a doctor or a veterinarian. Can't even read my own notes sometimes. I have to look at it. But I think Shadi, I think we've covered everything on my end. Is there something else that I missed that you would like to speak about?
Yeah,
The platform is yours.
Thank you. I absolutely am honored to be here with you guys, and I thank you for the opportunity for it. I guess my main message would be to clinics, to practice owners, because they're the ones who hold the key to the culture of their staff, and the health and well-being of their staff from a work-life balance is vital. And the newer graduates, the veterinarians that are coming to the field, they are graduating with that mindset. They don't care as much about the salary as they do having that balance. And so we need to start tailoring our current brick and mortars to appease those new grads, because those new grads are going to replace the ones who are going to be retiring, and we need to have that work-life balance. So I would say consider not just VetTriage to help with that work-life balance, but everything in your toolkit to figure out a way to make that work culture as optimal for those new grads as possible. And don't forget your receptionist, your kennel assistant, your licensed veterinary technicians. Everybody on the floor needs work-life balance, not just the doctors. So my message would be that. Have clinical practices, academics, emergency hospitals, reach out to me and any other resource to try and work on that work-life balance. That's going to be integral to the future of this field being successful in the long term.
Well, we do have veterinarians that listen to Fuzzybutts and Friends, so that's the good news. We have a lot of veterinary oncologists that check out our show, and we will do our best to get the word out, Shadi, about VetTriage. Ginger, you can follow up with you about marketing, and we have swag bags. It's no expense to you, or I don't know how that works. I shouldn't say that. I'm not the business person of Puppy Up. I'm just the founder. That's all I am. But the more that we can do to get that message out, again, everyone needs a bigger toolbox in this universe. I mean, I shouldn't say this universe, everybody at every level, from vet all the way down to pet parent, all the way back up, has to have we need bigger toolboxes. So, all right, Shadi, on that note, this is the part of the show where we yield the floor to Ginger Morgan, the executive director of Puppy Up Foundation, to give us a message from Puppy Up about cancer in our canine companions. Go ahead, Ginger. Take it away.
Well, okay. So, you need to look for the early warning signs. We've talked about, some of those things for hemangiosarcoma, but one of the things that I like to repeat every so often is really to keep your pets at a weight that's not obese. You need to keep them. And, earlier I mentioned that my dogs live to be, Lily, she's had cancer twice. She'll be 16 in November. I've had big dogs live to be 17 years old. And I really watch what they eat. I can tell you every day, like how many cups of food. I measure it out. I know exactly what it is. And I just want to urge people to pay attention. A lot of people think that giving their dogs a lot of treats and feeding them, that's showing them love. And it's really not, because not only because it stress their body and cause cancer, but it also will bother them later in life when they get arthritis or osteoarthritis and all those things. It's just weight is for people and for our pets not good to carry. So that's my tip.
Yeah, that was...
Give your dog treats, but go ahead and break them in two. And yeah, your dog knows that you broke it in two, but you know what? They get two instead of one, so they're still happy.
That was Dr. Hamid Modiano's point from last week, actually. It sounds like you've been doing your homework and listening to our podcast, our little podcast, because that was...
Well, of course I do.
Well, I know it was good. We talked about this, but it's a great point because, but not just cancers, obesity causes so many health problems. And his point was, it's not what they eat is important, but the most important thing is make sure they're within their weight and they're active. All right, great. That was great advice, Ginger. Thank you so much, and thank you from the Puppy Up Foundation. So, Shadi, before we sign off, where can people find you? Where can people learn more about VetTriage?
So VetTriage.com. It's VETTRIAGE.com. That's our website. We also have I've got a YouTube channel, so Dr. Shadi Ireifej. There's also a VetTriage YouTube channel. I'm on TikTok as well. It's Dr. Shadi Ireifej VetTriage on TikTok. Instagram as well, Dr. Shadi Ireifej and VetTriage on Instagram. So we're all over the place with social media. We've got a LinkedIn, all the things. And so any one of those methodologies, go ahead and reach out to us. We'll be happy to help out with anything we can.
Absolutely. Are you on Twitter too?
You know what? No, I'm not. I think we have a VetTriage Twitter, but we haven't leveraged it yet to the extent that we probably should be, but not yet.
The dog world, dogs of Twitter is a strange world that it's very difficult to get information that's useful to pet parents. It's mostly just cute dog videos and cute dog pics, but the cat world seems to rule Twitter for some reason.
Wow.
But I will make sure that we share this episode on social media with you. And with VetTriage, we'll certainly do that. So as we're wrapping up, everybody, check us out at FuzzyButtsStudios.com or on your podcast platform, iHeartRadio, Spotify, or some of the others. All right, Ginger, did I leave anything out? Did I screw anything up this time?
I don't think so. I think you
right.
you did well. How's that?
I aspire just to do well
I know.
in this world, so good for that. All
That's
right,
a
everybody, we had a
compliment
great
from
time with Shadi. Thank you so much for VetTriage. It was a tremendous pleasure talking about the wonderful things you do for our Fuzzybutts, and you are indeed a friend of the Fuzzybutts, and you're welcome back anytime to talk about new programs, new services, interesting cases, anything like that. So
Thank you.
All right, everybody, we will see you next week. Thank you very much. Thank you, Ginger. All right, everybody, we will see you next week. All right, puppy up. Talk soon.
Record.